We can see a lot of gastrointestinal problems related to cystic fibrosis, including impact on the intestines and impact particularly on the pancreas. And so that can affect growth. We struggle often with our infants on making sure that they can absorb sufficient calories from what they eat. The pancreas doesn't work, and what the pancreas does is actually it's enzymes to which you eat, helps you digest it, break it down, and then absorb it. And that is often the first big problem we struggle with little kids. And then, unfortunately, as kids with cystic fibrosis get older, we tend to start to see some lung infections. And that usually starts after the nutrition issues. And the better we get that nutrition, the less likely and the less frequently we see those lung infections. But those infections can lead to recurrent episodes of bronchitis. And sometimes those bronchitis episodes are relatively straightforward to treat. We put the kids on antibiotics and they bounce back and do well. But episodes of bronchitis with cystic fibrosis can be pretty severe, and they can lead to hospitalizations. And many of our kids with cystic fibrosis have had to be hospitalized and have had to spend time in the hospital, both for lung problems, but also even for gastrointestinal problems. Because both of those issues, both of those organ systems have problems really throughout their life. And the life expectancy for patients with cystic fibrosis was about in the early 40s. You ask me now, what do I expect for life expectancy to be? The honest truth is I expect it to be near normal. One of the most dramatic differences that we've seen since we've added medicines like Trikafta is how infrequently we have patients in the hospital. So prior to Trikafta, we used to typically have a couple of patients in our children's hospital with cystic fibrosis at any given time. And now we will go weeks and sometimes even months in between hospitalizations, because our hospitalization rate has really fallen so dramatically because of the benefits of Trikafta. I've had many patients over the years that have had cystic fibrosis who have had to go on to things like lung transplantation. Although the honest truth is lung transplantation is not an ideal situation, because transplanted lungs honestly don't last very long. They give you about another decade and that's about it. So most of our patients who have had lung transplantation have subsequently had severe lung issues with the transplanted lungs too. But one of the things that I expect that we're going to see is with the newer medications, the frequency with which children or even adults with cystic fibrosis go on to develop lung disease so severe that they need transplantation is going to diminish dramatically. We as a CF team really work very hard through the years on making sure kids develop an understanding of what their medicines do and which medicines help in different areas. So we actually do most of our cystic fibrosis care on a specific day of the week. We dedicate our clinic to that because the care model is different. So we only have our CF care team here one day a week because that's about what we need to really care for all of our patients. Now myself and my partner, Dr. Dramer, we're here all the time. So if the kids get sick, we see them any day. But our general regular scheduled appointments with our CF patients are done on Thursdays. And we have 15 CF patients that we'll see in that day. And it's awesome to be able to see those kids. It's really been phenomenal to see the difference. And the difference over the last few years.